All right, welcome back, everybody. Trinity Health of New England's primary care provides patients of all ages with lifelong health care that is essential for your health.
Yes, from your regular checkups and preventative care to treatment for the common illnesses like colds and flu. Taking care of your health has never been easier than with Trinity Health of New England. So here in studio is to tell us more is Dr. William Rabatai, Chief of Primary Care at Trinity Health of New England Medical Group. Thank you for being with us, Doctor.
Thank you very much.
I've had a primary care physician my whole life, and sometimes I'll ask Mike, a friend, they're like, oh God, I don't feel good. And they'll say, I'm like, well, go to your primary care. They're like, what's that? I'm like, how do you not have a primary care physician? It's
agree.
So important.
It is.
Why?
Why is it?
So your primary care doctor is like your healthcare coach, basically. So he's the person, like your general contractor. So if you're going to, redo a room in your house, right, you kind of want one person that's kind of help guide the ship where it needs to go.
That's such a great analogy.
Right?
I like
love
that. Yeah. So someone who sees the big picture of everything going on, gets all your reports, because you have other as a woman, you might have an OB, you have other things, but someone's getting all those reports and making recommendations, making sure you're getting the right tests and everything.
Exactly. So we can see the forest for the trees.
Okay.
And they will keep. They can look back 10 years, 15 years and say, oh, well, you had this then, and now what you've got now. I mean, they've got the whole thing.
That's the idea. Sometimes it's hard just with, the way that people will retire and move on and things like that. But it's great if you can find a doctor that is with you for the majority of your life. That's really wonderful. I just saw a patient and said, no one knows you like I do. So,
which is so true.
Yeah.
Now, the other thing is people move around, and we've had a primary care shortage, so it's been difficult. But at Trinity Health, you're saying it's easy. We can get that primary care doctor. We can get that healthcare coach who can see everything.
Yeah, so there is a primary care shortage, and we are really trying to make sure that we have good access at Trinity Health of New England. So we have lots of primary care practices all around the Hartford area, and then also in Waterbury and Springfield.
Yeah, that's great.
And how do we go about that? Do we just show up at how do we do it?
How do we get one if we don't have one?
How do we get one if we don't have one?
So very easy. We have a call number, so 1-833-CU-NOW. Very easy.
Oh,
that's
really
1-833-CU now. I love it.
Yeah.
We are very instant gratification, so that works.
And then we are also really pioneering and championing online scheduling. So.
Okay.
So can you, I know we can do telehealth, which has been a lifesaver, I think, for me. For the primary care, for that once-a-year physical, you still want to go in person usually?
You really do. So it's just, telehealth is great in some circumstances, and especially if you're not feeling well or if you think you may have COVID. But otherwise, it's really good to actually, allow us the opportunity to lay hands on you if necessary, listening to your lungs, listening to your heart, and things like that.
Yeah, healthcare is not one size fits all. We know that. And, the screenings, they're so important. What type of screenings do you recommend? What do I ask for when I go to this primary care physician?
So cancer screening is one of the biggest things.
Oh, yeah, that's a big
so
one.
colon cancer screening, mammograms, and things like that for breast cancer. So that's something that the general population should do based on their age, but then also needs to be tailored because it's not a one-size-fits-all thing. So we want to make sure that your primary knows your risk factors and family history and things like that.
Yeah, I mean, I didn't actually know that. They said, any colon cancer in your family? I said, yes, I had a grandmother die young from it, and my father never had colon cancer, but he had polyps. And they said, well, that's cancer. So they made my screening 40 instead of 50 or whatever it was.
Yeah.
So I wouldn't have known to go early if you don't have a doctor telling you.
Exactly.
And early action means you can prevent or even cure a lot of things.
Yeah, a lot of diseases aren't readily, notable to patients right away. So if we can help find them early, then a lot of times it will lead to better health outcomes.
And what I love about my primary care is if he doesn't know it, he knows the specialist who does know it.
Yes.
He knows everybody in the field, and they can recommend people the next step to go to.
So going back to that general contractor, so you may need carpet or you may need paint. So we know the best people that will be able to provide that. So the best cardiologist for you, the best pulmonologist for you.
Which is terrific. All right, the easiest way to get started is to schedule online.
Yeah, for more information and to find a location near you, you can visit trinityhealthofne.org/PCP. You might even want to take a screenshot of your screen right now. It's all up there for you. Doctor, thank you so much for being with us.
Thank you very much for
pleasure.
having me.
Happy holidays.
Thank you. To you too.
Good to see you.